Mental health is defined as a state of well-being in which an individual realizes his or her own potential and abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her community. Mental health is a key determinant of overall health and socio-economic development. It influences a variety of outcomes for individuals and communities, such as healthier lifestyles, better physical health, improved recovery from illness, fewer limitations in daily living, higher education attainment, greater productivity, employment and earnings, better family relationships, social cohesion and engagement, and improved quality of life. Mental health conditions are due to multiple factors that can affect an individual's mental well-being, leading to higher rates of disability and mortality, as well as barriers to full participation and inclusion to the community. Mental health conditions also directly and/or indirectly increase risk factors for other diseases such as diabetes, cardiovascular disease, injuries, among other ailments. Mental health conditions are common, affecting 1 in every 4 people at some point in their lives. In other words, every nuclear family is likely to be affected. Kenya as a country are slowly but surely drawing awareness to the impact of mental health to her people. The progress being made is positive. However, there exists many factors that do offer pessimism in bringing awareness to this matter in this country. A key factor that plays a part in this is the cultural misunderstanding and stigma that exists within our society. Many patients that suffer from mental problems are not taken as seriously enough and are pushed to the back for those who have quote-unquote much more serious ailments. Moreover, in many cases, patients are considered to be victims of madness and the proper diagnosis is never administered. Stigma and discrimination are major barriers to the improvement of mental health and well-being of the population, as it not only constitutes human rights violations, but it also shuns members of our society. Another problem that does affect the progression of mental health awareness in Kenya is the lack of know-how and resources in dealing with the mental disorders. Ailments like depression, schizophrenia, anxiety, bipolar disorder, post-traumatic stress disorder, just to name a few, are some of the illnesses that constitute mental issues. But not every medical institution is well equipped to handle patients of these diseases. In addition to that, there are very few mental institutions in the country. Thus, a man who may have bipolar disorder in a remote area may not benefit from proper healthcare. It raises a question as to how to help them in their situations, considering that very few people have the merit and capacity to assist such patients. Kenya is experiencing a rapid increase in suicides, mental health conditions, substance abuse, and addictive disorders of an epidemic proportion. This is an indication of social challenges and unmet needs at a societal level. It is estimated that 50% of all mental disorders start by the age of 14 and 75% by the age of 24 years. This country is making progress towards a sustainable healthcare system that caters to a mental patient. It will take time, but eventually we will get there.